Now, acute causes of ataxia, just to list down the important causes. Vascular cause, number 1. Stroke, ethanol intoxication, Wernicke's encephalopathy, multiple sclerosis, infectious cerebellitis like chickenpox, drugs and toxins, phenytoin, lithium, mercury, thallium, poisoning. All these poisoning can result, or toxicity can result in acute ataxia. Okay. Subacute ataxia can be a part of paraneoplastic cerebellar degeneration as well as Creutzfeldt Jakob disease. Chronic ataxias may be a part of genetic ataxias. Or if it is elderly, you can think of multiple system atrophy type C. And mitochondrial ataxia is also chronic. Now, you should also consider about this episodic ataxia. You have got a specific entity, EA, or episodic ataxia with different subtypes. Okay, right. And even you can say multiple sclerosis to be a type of episodic ataxia in case it is the remitting relapsing type, where again, initially there was a sort of demyelination in the cerebellum. In the next episode also there is a demyelination. That also can rarely produce a sort of episodic ataxia, but you know there is a classical entity otherwise known as episodic ataxia. Now, another part is when a patient has ataxia as a symptom, just see if it is a pure ataxic syndrome or is it ataxia plus. So what is this ataxia plus? Ataxia plus something. So patient will be having additional features. Now, just to have a quick checklist. If the patient has Parkinsonism, additionally, other than ataxia with some sort of autonomic dysfunction, think of multiple system atrophy type C, dementia and myoclonus, rapidly progressive dementia, myoclonus, visual disturbances. You can think of Creutzfeldt Jakob disease. Visual problems in relation to ataxia or oculomotor disturbances can happen in Miller-Fisher syndrome, MFS, where you can have ophthalmoplegia. The multiple sclerosis, where you can have optic neuritis, vitamin B12 deficiency, where you can have optic atrophy, Wernicke's encephalopathy, where you can have, again, ophthalmoplegia. Peripheral neuropathy can be a part of Friedreich's ataxia. Even vitamin B12 deficiency also can produce peripheral neuropathy. Okay, vitamin B12 deficiency. Okay, right, because it can produce subacute combined degeneration, and this also can produce peripheral neuropathy. Now, if there is fever, think of infectious cerebellitis like chickenpox. GI symptoms, think of Whipple's as well as A-beta lipoproteinemia. Constitutional symptoms may be paraneoplastic, and multi-system affection, ocular, ear, combined with ataxia, think of mitochondrial disorders. So basically, in case of an ataxia plus, you have to have a focused approach so you can narrow the differentials. Because causes of ataxia are numerous. If you want to come to a diagnosis, you will have to have a focused approach.